Welcome back to On the Beat, everyone. I'm over here with Dr. Woody and OR Manager Nancy from Monroe Regional Hospital Surgical Services, and we're talking a little bit about behind the scenes and about this dynamic duo who have been working together, for almost over 20 years, Nancy?
Yes.
Okay, how did that all come about 20 years ago? You were just placed under him?
Well, no, I was already working in the hospital when he started.
Yes.
I had been there maybe 6 years, and then he started. I was working in another department, but I knew him because he rounded on the floor.
Okay.
And a position came open, and I always wanted to go to surgery, so I did.
Perfect.
And then I loved general surgery. That was my big thing, and he was the general surgeon, so we just worked well together. We just, for whatever reason, I knew what he wanted. If I didn't, he made sure he told me.
Okay, 20 years. You must know her better than her own husband, probably.
Maybe.
Yeah. Well, it's a pretty close
work.
work.
Quite a bit of time together.
Well, I was going to say, you work in a high-pressured environment.
Yes.
Being a general surgeon, you have to have 100% in Miss Nancy.
Yes.
Yeah.
Yeah.
Okay, what type of surgeries are you offering over there?
So I do general surgery, which generally is abdominal procedures that involve the gallbladder, the colon, appendix, hernias. We also do quite a bit of skin cancer removal.
Okay.
And then also endoscopies, upper and lower endoscopies.
So is the centre for emergency services, or are they elective?
It's mainly elective surgery.
Okay.
Obviously, we handle surgery emergencies when they come in, but it's mostly for elective surgery.
Tell me, Nancy, when did you open the new practice?
We opened officially December the 4th of 2014.
And there was obviously a need for expansion and a bigger service area for that environment.
Yes, the hospital in Aberdeen they were expanding their services to better cover Aberdeen and the southern end of Monroe County.
Okay, why, sitting at home, since you are elective for surgeries, why would someone choose your hospital?
I think we have great staff.
Mm-hmm.
We have a wonderful staff of doctors. We're very personable with our patients. We have a good relationship with them. We have a good relationship with each other because most of our OR crew, we've all worked together for years.
Really?
And it does make a difference.
So it's more like a family environment.
It is.
Yeah.
What's one of your rewarding points about being a surgeon?
Really, it's just getting to know people and getting to sit down and visit with my patients.
Yeah.
And of course, being able to help them to feel better and remove cancers and that kind of thing. But the biggest result is just getting to know the patients.
How do you feel about people self-diagnosing and coming up with the wrong diagnosis? Nancy?
Well, all you can do is send them to the doctor and let him do some testing and find out if it's good or not.
That medical MD is sometimes the worst thing, isn't it?
Yes. but I think you have to always consider that the patient may just be right. And so that's one of the first things, you can't discount what they tell you.
I agree, and I think it's about having that right ear, having a good listen, and it starts from people like you, Nancy, all the way up to you, Doctor. We appreciate both of you coming in, sharing a little bit of behind the scenes of Monroe Regional Hospital Surgical Services. Dr. Woody and OR Manager Nancy. If you want to find out more information, it is all up on the screen now for you. We'll be back after this short break. You're watching On the Beat.